Hey everyone, it's Nurse Dani, and today our guest is Dr. Puttgen. We have her on today because it is Skin Cancer Awareness Month, and she's going to share all things dermatology with us today. And so tell everyone a little bit about yourself.
Sure. So I'm Kate Puttgen. I'm a recent transplant to the Salt Lake City area. My family just moved here in December. I worked for the last 11 years in Baltimore at Johns Hopkins, and am really excited to be a new Utahn, and eager to be here, and excited to be here talking about Skin Cancer Awareness Month, which is super important for all of us to be thinking about for ourselves and for our kids.
Definitely. So there's so many things we should think about when it comes to skin cancer. One of the ways to protect ourselves is to avoid the sun during certain times during the day. What are those hours that we should avoid if possible?
So the peak hours that we really want to try our best to avoid are between 10 a.m. and 2 p.m. That's when the sun's rays are the strongest and you're most likely to end up with a sunburn. And so if you can avoid or stay out of the sun and be in the shade during those hours, that's best.
So if you want to go on a picnic and go eat lunch outside, just be covered. Use a canopy or an umbrella or sit underneath a gondola or something. Okay, so if you are going to be out in the sun, let's talk about sunscreen. Mm-hmm. There are a lot of people right now are talking about toxins in sunscreens and how it might be harmful, but wearing it and avoiding sunburns is certainly important because sunburns can lead to skin cancer. Tell us more about that.
So absolutely. So, our risk of skin cancer goes up at least double if you have had more than 5 sunburns in your lifetime. And we know that 1 in 5 Americans will have skin cancer at some point in their lives.
1 in 5.
1 in 5.
That is 20%. That's pretty high.
It is very high. And so we really want to make sure sunscreen is one part of a comprehensive sun protection plan for you and for your family. So seeking shade and seeking cover, using protective clothing is very important, but sunscreen is a very important part of that plan. Sunscreen is safe and effective at helping to reduce our risk of sunburn and skin cancer and reducing aging and wrinkles as well.
That might hit it for some women who didn't want to wear it for any other reason. Sunburns make you age faster, yes?
Absolutely. Absolutely. And just routine sun exposure. So it's estimated that 90% of skin aging is secondary to sun exposure. So you can kind of tell the difference between the skin on your face and the skin on your sort of double covered areas.
So true.
Most of that is from sun
exposure.
exposure.
You heard it here today. It helps roll back the clock or keep it from ticking faster.
Exactly.
Okay, so babies. When you want to take your baby out into the sun, you talked about avoiding exposure, light cotton clothing. Can you put sunscreen on babies?
So you can put sunscreen on infants. It is FDA approved down to 6 months of age. And really below 6 months of age, those children are not crawling yet. And so it is within our power as parents and caregivers to keep them protected with protective clothing and shade, canopies on the stroller, et cetera, to make sure that they're protected. If sun exposure in an infant under 6 months of age is unavoidable, then it is safe and now recommended by the American Academy of Pediatrics that we can apply a sunscreen product to infant skin if sun exposure is unavoidable. But really that should just be hopefully to the backs of hands, tops of feet, and to the face. In young infants of all ages, I recommend using a type of sunscreen called a physical sunscreen or an inorganic sunscreen. And the 2 active ingredients in those are zinc oxide and titanium dioxide.
That's the white stuff you see people put on their nose in the movies.
Yes. So in the old days, it was pretty opaque, but a lot of the formulations are more cosmetically elegant these days. But you're absolutely right. Those are the ones when people think of sunscreen being a little white and pasty. Those are often the active ingredients. But there are some nicer formulations formulations that you can use both for yourself and for your kids. In little kids, I actually love that it is kind of white and pasty because then you know exactly where you've put it and where you haven't. Exactly. Yeah. But for older kids and teenagers especially who don't want to go around with that whitish cast, there are nicer formulations. The other thing that's really lovely about zinc oxide and titanium dioxide products is that they give really good broad spectrum UVA and UVB protection. So UVA rays are the ultraviolet rays from the sun that we attribute to causing aging. They penetrate deeper into the skin, and they also contribute to our skin cancer risk quite a bit. UVB rays are the ones that are responsible for burning and sunburn. Okay. And so when you see SPF on the bottle of your sunscreen, what the sun protection factor in the sunscreen is really talking about is how well it blocks those UVB rays. Most of us do not apply as thick a layer as is recommended. So for an adult, for instance, most of us should be using 1 ounce of sunscreen or about the size in a shot glass to cover our bodies. And if you think about it,
who uses that much?
Not as many of us as we ought to. And so because of that, when you're putting on a 30, most studies have been done that show that most of us put on somewhere between 1/4 and 1/2 the amount of sunscreen that we really ought to.
So you may be getting more of a 15 coverage, and that's the bare minimum that you should have, right?
Exactly. And then the other important thing, of course, with sunscreen is that we need to make sure to reapply if you are swimming or sweating after 40 or 80 minutes, if you're using a water-resistant sunscreen.
After 80 minutes. Mm-hmm. Okay, that's good. It's good to set a timer so that you don't forget. That's when I guess I'm putting myself out here a little bit by saying this, but the few times my kids have gotten sunburned, it's been when I just totally forgotten too much time passed, and I may have thought about it 2 hours later, but not an hour later.
Yes, exactly.
And so I started noticing their skin turning a little bit cherry pink, and I'm like, reapplication time.
Exactly. So 2 hours, every 2 hours at the maximum is definitely when we should be reapplying sunscreen for ourselves and for our kids. But one other important thing to look at when we look at the labels on the sunscreens when you're at the store is to see, especially in summer, I recommend looking for ones that say that they are broad spectrum, meaning they block UVA and UVB rays. And then there is additional testing that sunscreen companies can seek to suggest that the sunscreen is water resistant for either 40 minutes or 80 minutes. But it's important to realize that no sunscreen is waterproof.
Right. So the sport kind, those would be the ones that are maybe going to be a little more, they'll stand up to water for longer.
Exactly. But it should say it on the front of the bottle, water resistant 40 minutes or water resistant 80 minutes. And if it doesn't say either of those, then it's not.
Okay. Good advice. What about baby-specific sunscreens? Do you need to pay more money for baby-specific sunscreens?
No, not necessarily. In most cases, things that are marketed and say that it's a baby sunscreen, occasionally that can be an indication that it is less likely to be heavily fragranced or is hypoallergenic. But in a lot of cases, depending on the company, it's really just the same product as their regular sunscreen. And for marketing purposes, they've just written the word baby on the label.
So don't pay more money for it.
Don't necessarily have to pay more money. But I do think that those physical sunscreens, as opposed to the chemical sunscreens, they're less likely to be irritating in little ones, and especially for young kids and toddlers and babies who might be rubbing sunscreen in their eyes.
Yeah, so when you put it on the backs of their hands, the first thing they do is put it in their mouth or on their face.
Exactly. Yeah. And so those physical sunscreens are less likely to be irritating and really good for not only babies but anybody with sensitive skin or eczema.
Oh, that's good advice too. Yeah. Okay. So when it comes to skin cancer, what types of things should you look for, and when should you see a dermatologist?
So anytime you've got a new spot on your skin that doesn't look like your other existing moles or spots, that's something to pay attention to. Anything that is new, itching, growing, bleeding, changing, that's a reason to go to see your dermatologist and have them take a look and do a full skin exam.
Best case scenario, you tell me that everything looks good and you go home with some peace of mind.
Yes,
right?
Absolutely.
But with skin cancer rates being 1 in 5, you don't want to risk it by not getting something checked out.
Yeah, absolutely. And the other thing to really emphasize is that if we catch skin cancers early, almost always it is curative. And so it's really just coming in and getting that early detection to make sure that we can keep everybody as healthy as possible.
Do you recommend regular screenings for this, since there might be some things that you don't recognize but a dermatologist might?
So it's a really good question. There is a little bit of controversy about this, but I recommend skin cancer screening at a baseline for all adults, especially adults with fair skin, and anybody.
Say those risks. You told me some risks earlier.
Yep.
List those for everyone else. I think that's really helpful.
Yeah,
It means that if you don't say this, you're not at risk, but.
Right. So folks at higher risk for skin cancer are folks who have already, they themselves, had a skin cancer before. That increases your risk for getting another skin cancer. If there's a family history, especially in a first-degree relative of skin cancer, that
meaning like your parent or
your parent or a sibling. Exactly. And so if they've had skin cancer, that puts you at higher risk. Anybody with fair skin, blonde hair, and so anybody who is an adult should come and get a baseline skin exam with a dermatologist. And then most adults in those sort of higher risk categories should be followed at least yearly with repeat skin exams.
Starting at a certain age or just in adulthood in general?
So adulthood in general, it's a little bit less clear when children need to get their first skin exam. And so I usually tell families that if there is a family history in a parent of a skin cancer, certainly if a child was born with a mole, or again, if there's a new itching, changing, bleeding spot that just doesn't look like the other moles and freckles, then that's something that is really worthwhile just coming in to get a good baseline exam. And most of the time in children, that's just going to provide peace of mind and another opportunity for us to answer questions about sun protection and sunscreen and just keeping your child's skin healthy. It's definitely recommended by the American Academy of Pediatrics that pediatricians and primary care providers should be counseling children between the ages of 10 and 24 about using good sun protective practices. But I think it's never a bad idea to get a spot checked out with a dermatologist or with your pediatrician if you have a concern about your child.
So you are a pediatric dermatologist. So explain the difference. Obviously, you take care of kids, but what conditions may kids have that adults don't?
So a lot of times pediatric dermatologists receive extra fellowship special training in pediatric dermatology, and we have more experience treating different birthmarks, different vascular tumors like hemangiomas, port wine stains that occur in children, and have a lot of expertise in treating pediatric skin disease, severe eczema, psoriasis, other things that may happen in kids, but we love seeing common things too. So acne and eczema and moles, it's all very important.
So expound on eczema. That is a frequent problem, and it seems like it could be worse during the first couple of years of life. Does it get better? Does it get worse? What do you typically see?
So it really depends. So there really are these kind of different groups of kids, and some kids will have early onset eczema that is early resolving, and so it will go away by the time they are out of infancy or are toddlers. But then there's another group that can have early onset eczema that then persists through school age and then goes away. But some kids, it really will persist throughout adolescence and adult life.
And it's linked to allergies too.
Yeah, absolutely. So usually atopic dermatitis, or what we commonly call eczema, is kind of the first condition that we see in what's often referred to as the atopic march. And so usually skin involvement starts first, and then kids could potentially develop food allergies or seasonal allergies or asthma. Your risk of having eczema as an infant is certainly increased. If one parent has eczema, you've probably got a 1 to 2-fold increased risk. If both parents have a history of an atopic disorder like eczema or asthma or allergies, then your risk goes up 3 to 5 times that of everybody else.
The good news is if parents have been dealing with it, then they usually know what to look for and how to help their kids.
Yeah. But I will say there is some really encouraging data about these high-risk families where there's lots of eczema, that in newborns that we may be able to actually prevent eczema from developing in some of these kids in high-risk families if we apply a good greasy ointment-based moisturizer like petroleum jelly head to toe, starting soon after birth and continuing that for the first couple months of life. And there have been some really encouraging studies, both here and in Europe, suggesting that we may actually be able to prevent those kids from developing eczema that they otherwise would have developed.
So if you or your partner have severe cases, or even just a moderate case that's been bugging you for your entire lifetime, talk with your pediatrician and get a plan.
Absolutely.
See a dermatologist early on.
Yeah,
that's really helpful.
Absolutely.
Wow, that's great. So some other common newborn problems that parents have questions about. Tell us more about Cradle Cap and like baby acne.
So Cradle Cap and baby acne, I usually like to tell parents, these are rashes. You should enjoy them while you've got them, because it's just a sign that your newborn is just young and perfect and little. Because the good news about both those conditions is that they will self-resolve. So usually baby acne will resolve, if not in the first month of life, within the first couple months of life. Rarely, if it's more significant or severe, then you should talk to your pediatrician or a dermatologist, and there are some medicated creams that we can give. But most of the time, just a good, greasy, bland, fragrance-free moisturizer is all you need for the baby acne.
You don't need to be washing and putting all kinds of lotions and potions on their face.
Exactly. I think just a good, bland, ointment-based moisturizer is all I would do. But actually, we want to probably try to avoid over-washing and over-cleansing, because sometimes that can make the problem worse instead of better. For Cradle Cap, that's again something that for most babies disappears on its own between 6 and 8 months of age for most babies. I usually recommend treating it only if it is symptomatic. So if the child seems like they're itchy or uncomfortable, or if it's very, advanced and visible and noticeable, then we'll do some things. What you don't want to do is try to mechanically remove the scale, because that sort of actually creates a vicious cycle where it can cause more scale to come. But usually just a gentle cleanser, just whatever you're using as your newborn cleanser in the bath is appropriate to use on the scalp. I usually recommend avoiding harsh dandruff shampoos that are marketed for adults, because sometimes they can get in the eyes and sting, and sometimes make the skin more irritated. So again, enjoy it while it lasts. But if you're not enjoying it, then come talk to your dermatologist or your pediatrician, and we can work with you to come up with some good strategies to help your infant through that rash.
I think that's reassuring for parents to hear, because with both of those conditions, a lot of times they feel like they're being neglectful or not doing something that's contributing to it. So it's good to hear that it's natural and normal and it will pass and you're not doing anything wrong.
Oh, absolutely. Absolutely not. No, it's really just a sign that your baby's skin is just getting used to the world outside of the uterine environment. And with that comes a little bit of peeling and flaking and bumps every once in a while. But this is nothing that we're doing wrong. It's just a normal part of being a baby.
Very reassuring. Parents notice everything because you hold your babies and you inspect them.
Exactly.
You just love to look at them. Okay, so speaking of bumps, what about bug bites? We're going into the summer months and we're going to be outside, and if you notice certain bumps on your child's skin, when should you be concerned about it being serious, and when is it something that you can just keep watching?
So most bug bites, of course, are not going to be a serious problem, but they can be itchy and uncomfortable. And so I will recommend to families of kids who tend to get more bothered by insect bites or get more significant reactions to insect bites to use an insect repellent on a daily basis during the summer.
Can that be applied to babies too?
It is approved. DEET containing insect repellent, so the active ingredient DEET, is the most effective insect repellent and is approved down to 2 months of age, and can be used as long as you follow the label's instructions very safely in young infants. And so that can really help to decrease the burden and the number of bumps and spots that you get. But if you do have a spot that's irritated, usually just applying a little bit of an over-the-counter hydrocortisone or some calamine lotion, old school calamine lotion, can be helpful in soothing.
I can smell it right now.
Exactly. So, but if the spot is warm, if it's tender, if it looks like there's pus, or if your child has scratched it to the point that it's bled and it's really looking angry and inflamed, it may be worth talking to your pediatrician or your dermatologist about, just to make sure that it's not secondarily infected with bacteria, and we might need something else to sort of help it along to the healing.
Or spreading, like getting bigger and bigger and bigger.
Exactly.
Or bigger or changing color. Would that be another thing to watch for?
Absolutely.
Okay. Well, that's good advice. Summer's coming. We hope it's coming. In Utah, it's overcast and cold. So we hope that the summer months are coming and we'll have sun. We can go out and that we'll need protection.
Yes. Well, you need protection even on cloudy days.
That's right. Let's talk more about that. And elevation too. So you can get a sunburn or you can be exposed to those rays when it's cloudy.
Yeah. So, and a lot of times that's when a lot of people will end up getting a sunburn, because you feel like it's not in the front of your mind because it's not hot when you walk outside. But sometimes it's really those cloudy days where you can get the most significant sunburns because you just don't realize that it's happening. So if you can see the sun, if it's light outside, you need your sunscreen on.
And elevation. We talked a little bit about this before we started too. In Utah, we're at a higher elevation than, say, like California. I've noticed, definitely, if I go outside, it's easier. I get burned faster if I'm outside in Utah and you go to the beach and you feel like you could be out there all day and you're not getting burned. But tell us more about that.
So you're absolutely right. So we are at increased risk here in Utah because of the elevation. And so the sun's rays are stronger and we're less easily protected. And Utah as a whole has a more fair-skinned population. And so if you put that fair-skinned population in a high altitude location, it's a combination that just behooves us to be really diligent about our sun protection, sun protective clothing, and our sunscreen.
Is the skin cancer rate higher in places with higher elevation?
Yes, Utah has quite high rates of skin cancer compared to the rest of the nation for those reasons.
So we quoted 1 in 5 before, but it's even higher for those of us around here.
Probably a little bit higher here. Yeah.
Okay, so even better, more reason to take it seriously.
Yes, absolutely.
We had a couple of questions come in on Instagram before our live stream. You okay to answer a few of those?
Yeah, absolutely.
The first one is, my 2-year-old has very dry skin on her back and looks a bit bumpy. What can I use for it?
So I would say the first thing I would do, my favorite in young children especially, are moisturizers that are ointment-based moisturizers. So the greasier and the more it looks like petroleum jelly, the better job it's going to do. You want to look for a product that's fragrance-free, says that it's hypoallergenic, doesn't have added perfumes or dyes, and then apply that thick ointment-based moisturizer at least twice a day. The most important time to apply is right after your child gets out of the bathtub. I usually call it the 3-minute rule. You've got 3 minutes to get out, pat dry, but really while the skin's still damp, that's the ideal time to sort of lock in that moisture.
Is it soaking everything in and the pores are open? Is that why?
Exactly. And then you can really give good hydration and protection to the skin. Ointments are better than creams. Creams are better than lotions. I really don't recommend lotions in kids who end up in my office to talk about their dry skin, just because lotions have a higher tendency to sting or burn, just because they have added preservatives and alcohols that can irritate young skin. But a fragrance-free thick ointment or cream is really going to be your best bet. If you're doing that 2 or 3 times a day pretty consistently and you still feel like you're not seeing good improvement, then talking to your pediatrician or a dermatologist would be a really good idea.
Okay, what about detergents? Would a change in detergent or soap possibly cause this?
So it's certainly possible. And again, sort of following the same theme, we would recommend fragrance-free laundry detergent. We really probably should, in kids with sensitive skin, be avoiding dryer sheets and fabric softeners. The good news is most of the major brands at the grocery store now will have a fragrance-free or free and clear detergent that they have available to us.
Would you recommend washing all of your baby clothes in that before your baby's born? One of those nesting things that moms do?
I think it's probably, well, I'll say it might not be necessary for everybody, but if you have a family history of eczema and sensitive skin, it's never going to be a bad idea. And it is one of those fun parts of nesting and getting ready.
It is. So. You pull out all of the baby clothes and it's like you're playing house before the baby gets there.
Exactly.
So not a bad use of time,
no.
For sure. Okay, we have another question. I'd like some pointers on dealing with little kids with eczema or full body eczema. So we talked about it, but not really what to do. This is a good question. I have a 3.5-year-old daughter, and we've done everything from no hot water, no fabric softeners, special soaps for her tubs, using hydrocortisone for flare-ups, etc. Is there anything else we can do? So typically, let's start with what parents can start off with, first line defense, and then if that's not working, what do they do from there?
So, I mean, it really sounds like this viewer's been doing all the right things, using, lukewarm, not hot baths, bathing, you just 5 to 10 minutes, but a daily bath or a bath every other day is probably really good for kids with sensitive skin because it helps to rinse off irritants and dirt and things that might cause irritation. And then again, when you get out of the water, pat dry and then grease up with that nice greasy ointment or thick cream all over the skin. If that's not helping, and even over-the-counter hydrocortisone is not helping to settle down the flares, then I think it is time to talk to your pediatrician or your dermatologist, because it may be necessary to incorporate a prescription medicine that can help to calm down some of those flares of eczema.
What good advice. There's so many helpful things that we've talked about today. Is there anything else that you'd like to add that parents should know about? For themselves or their kids?
I think the main thing is just that sunscreen is really just one part of a comprehensive sun protection strategy. So seeking shade, as we talked about at the beginning, making sure you're using sun protective clothing, using sunscreen with an SPF 30 or higher, remembering to reapply every couple hours. And then if there's a new or a changing spot you're worried about, go see your dermatologist.
I also liked you when we were talking before, you said use cream the first time on your kids and then spray to reapply. Because they're both effective, but the spray may be applied more unevenly. So the cream will give you a good base coat, basically.
Yes, exactly. Yeah. So I do think that it's helpful to get that good first nice thick layer, as thick as you can, with your sunscreen. And then if life gets crazy and you're having a great time at the pool or out at the beach and doing fun things, then reapplying with the sprays can be helpful. The sprays are also nice for hair-bearing areas and fast-moving kids. But you do need to be careful that they don't inhale the droplets. And so you never want to spray sunscreen on the face. You want to spray it on your hands and then apply it to your child and to yourself. And then just make sure, as you were saying, Nurse Dani, that you get kind of good, even coverage everywhere.
Good coverage, yeah. As, like you said, as good as you can with the fast-moving kids.
Yeah, exactly.
Okay, thank you so much for all the helpful advice today. We really appreciate you joining us. And where can people find you if they want to come see you?
Oh, thanks. I've had a great time. Thank you for having me. I'm working out of the Southridge Clinic in Riverton on Tuesdays and Wednesdays, and at the Holiday Clinic on Thursdays and Fridays. So would love to meet everybody who has a concern.
Awesome. Thank you so much. What a helpful resource. Thank you so much for joining us. And of course, you guys know where to find me if you have questions. Facebook.com/Intermountain Moms. You can also check us out on Instagram and YouTube. Have a great day, everyone.